We are start recording. So I'm just going to share with you. Okay, so Unit 3 is all about personal development in the care setting. So for you as a carer, can any one of you tell me what the duties, responsibilities of the Can any one of you tell me what's the duties and responsibilities for you as a healthcare? Yeah, can you think of any duties at all?
Administering medication, making sure that the patient is clean, feed, if you make sure that you give them food, just overall safeguarding and protecting them from abuse, from hurting themselves, making sure
That's
that they are well taken care of. Yeah.
Absolutely. First of all, we need to take care of them. And as you said, we safeguard them, we take responsibilities for their health, and also we give them medication, we feed them. If they need anything else to do, we work around them, so we put them in the center of our work. So if we follow here, it says, so we ensure that high quality of care and support is provided to individual by encouraging all adult care workers to work constantly and in a consistent way. So we make it clear that for the adults, so for us, what we do, we take care of them. We provide them with a good care. We provide them with medication, and we basically take care of them. So if I go here where it says the duties, our duties is to provide assistance to individual. Well, sorry, is it clear enough or you can't see it? Can you see my screen? Yes? Okay, so the duties is to provide assistance to individual when required with care task, which can include showering, maintaining their personal hygiene, preparing meals, managing money, shopping, attending health appointments. So this is all what you do for the people you care for. Also, to maintain daily records, including care plans. So you need to write everything about this person you're caring for. You put all this information in his or her care plan, and also to attend team meeting and support meeting as required. Obviously, to take training if required. Like some people would have extra special needs, then you need to take extra training to take care of them. This is our duties. How about our responsibilities? Our responsibilities is to respect the individual right, the individual's right to make their own choice and refuse assistance with tasks. And also to promote the individual independency and privacy and dignity at all times, to promote effective communication with the individual, and to carry out tasks using safe practice in the safe environment, and to ensure confidentiality and maintain at all times, and also to ensure that all our records are completed accurately, in timely manner, and kept up to date. So when you go to answer this question, it says describe duties and responsibilities. So we have to answer both parts of the question. First of all, we have duties towards the people we care for, which is we provide assistance to them. We like in regular daily tasks such as showering, maintain their personal hygiene, prepare meals, managing money, shopping. And also we provide up-to-date daily records about their health and their care plan. And also, if we need any special training, we attend it, and we attend any team meetings as required. How about our responsibilities? Our responsibilities, obviously, to respect them and to assist them and to promote their independency, privacy, and dignity, which is very important, and to promote a good communication with them, and to carry out all our duties in safe practice, safe environment, because we are providing them with safeguarding, and also to ensure confidentiality. So always we are very confidential with their information. We don't pass them unless it's required, and to ensure their records are always completed in accurate manner. So far, number one question, is this okay? Shall we go to the next one? Is it understood, or do you want me to repeat it again?
No, that's fine.
Okay, fine. So now, assess how well own knowledge, skills, and understanding meet the standards. When you see own knowledge, what does this mean? It means all about yourself. So you start saying me and I, rather than saying the healthcare should do this. It says assess how well own knowledge. So how well your knowledge to help people to meet the standards. So here I'm going to answer it as if I'm talking about myself. So when you answer it, you talk about yourself, yes? So you say, I do this, I do that. Now for this question, to answer it, you need to assess your own knowledge, how good your knowledge was. So if I go to 2.2, we will come back to this we passing now because it's in the reflective practice, so don't worry about it. Just I'm following whatever we have in just the question number. And then we can go back and do the other ones as reflective account. So if we go here, 2.2 still. Okay, so 2.2, assess how well your knowledge, skills, and understanding meet the standard. So can you assess your own knowledge and skills? What are the standards that you follow? Obviously, you follow the policy and procedure.
Yes.
And these, which has all the codes, all the things you need to do to the clients. And also, these standards would include codes of conduct and also national occupational standards. All your skills, all your knowledge, these are should meet these standards. So can each one of you tell me how you feel about your own knowledge and experience? Yeah, like for you as a healthcare, okay?
Mm-hmm.
You're starting, just say about, like, okay, let me answer as if I am you. So I'm going to say, I just started studying health and social care level 2. And I feel like I have the knowledge and experience because I worked, I helped before. For example, my grandfather, he was ill and I used to take care of him. I helped him a lot to get well and to get better. I helped him with medication. I helped him. I assisted him with his showering, with his movement because he wasn't able to move so much. And does this mean the standard? Then I would say, for me, by studying this course, I feel like it's continuing development for my own knowledge and skills. And taking this course, I'm starting to learn how to ensure that this person will be feeling that I'm taking care of, should be always feeling well, should be always feeling that he's been taken care of. And always I make sure maintain the safe practice. So I'm safeguarding to the people I care for. I always make sure that they don't fall. I take care of them. And also, so you just talk about how you feel, how you done it. Anyone of you at the moment working in health and social care? No? So as you can see here, let us imagine that you working at the moment in the health and social care, because this is all about you, about how you meet the standards. So for you, you say, I just started studying health and social care level 2. I'm working as a volunteer in a nursing home. So my duties are always, I follow the standards in doing my duties. And I start learning a lot doing this course. So the standards that I have is policy and procedure, and also I have the code of conduct and the national occupational standard. And for me, I always make sure of my continuous development through my work. If I need anything or if I have new skills, I always ask my manager and to help me with these things. And also I ensure that everyone I'm taking care of his well-being, of his safety at all times. And I start doing like you can say showering, serving food, taking care of the people I'm working for. Also, I do some shopping duties. I make sure always to follow the standards, which is the what is the standard? The national occupational standards, and also the policy and procedure.
Okay.
So you need just to reflect it. It says here reflecting. So spend time thinking about your knowledge, stand and experience, and start like talking about it, and also evaluating how good are you in these things. Do you feel like you still need some training in showering people or in giving medication, because you still don't know the timing, but you follow for this the plan, the care plan. So you just need to talk about your own experience. For me, I would say, to answer this question, I would be like, in the past, I took care of my grandparents. They were really unable to move. They were ill. I used to give them medication, do the showering, serving food. I used to do the shopping for them. So I feel like I learned a lot from doing these duties to my grandparents. And now I'm studying level 2 health and social care. I feel my skills and abilities are developing as well, because at the moment I'm working in a nursing home. So I do all these duties. I always follow the standards, which is the policy and procedure, and also I follow the standards, which is the national occupational standards, and always make sure my duties are doing to the best that I can. If I don't know any thing how to deal with it, I always ask my manager and my supervisor. So if you answer like this, that's very good. You can say some of the skills you still need the training. Like I'm not quite sure for you, maybe you still don't know how to, you're still learning how to take care of the people, or just everyone his skills or her skills is different. So you need to talk about your own skills in this question, because if you go to 2.2, it says assess how well on knowledge, skills and understanding meet the standards. So you just need to, so you can talk about the knowledge, which is taking care of someone in the family, and then the skills that you have, and how much you start understanding the training we do, which is level 2 health and social care.
Okay.
Yes?
Yeah.
Excellent. So now if I go to the question afterwards, it says demonstrate. Oh, we are doing the reflective. I need to do the other one. Okay, sorry. So we done the describe duties and responsibilities for own work. So we're done with this. Now identify standard regulatory requirement and agreed ways of working that may influence your knowledge, understanding and skills to carry out your own role. So identify standards and regulatory requirement, and also the agreed ways of working. So if I go to 2.1, okay, it's here. So identify standards, regulatory requirement, and agreed ways of working. So first of all, we need to identify the standards. So as we said the standards are code of conduct. That's the main thing. And practice. So what's code of conduct? Code of conduct and practice are agreed ways of working for professionals such as healthcare and social care worker, and other organizations that provide service such as care and support. The code of conduct for healthcare support worker and adult social care worker in England reflect best practice and it is not legal requirement. However, we follow these standards in our work, and also in our behavior, in our attitude. So it's very important to follow the code of practice. What does it mean? It means be accountable by making sure they can answer for their actions. So for us, we need to be always accountable for our own work. Whatever we do, we need to have answers for our actions. Like if someone would say, why did you do this? Well, I've done it because it's in the care plan. No one will say anything to you. Why? Because it's all being recorded. So, or you maybe you had the training to do this on this way. So that's it. If you follow everything you've been taught or you've been told, or you can check it in the policy and procedure, then that's it. No one can say anything to you. That's why it's called Code of Conduct. So first of all, you need to be accountable by making sure that you can answer for any of your action. For example, being honest about when things is not being done correctly. So if something happened or any mistake happened, you can tell straight away. You go to your manager and inform them about it. Why? Because it's part of your duty. So if you do anything wrong, you should report it. And also promote and uphold the privacy, dignity, and right of the people you care for. So it's very important that you always make sure of their privacy, dignity, and right at all times. For example, by supporting individual and care rights when meeting with them. So whenever you meet them, you always make sure you have you respect their dignity, their right, and also their privacy. Also, you need it talks about the way we work together as carers. So the way you work together with your colleagues is also included in the code of conduct. So you need always to provide high quality, safety, and compassionate healthcare. Also, in this code, talk about communication. So you need at all times to be effective and well communicated. As we said, you need to respect the right and confidentiality for the individual you care for, and also you need to be committed to improve the quality of healthcare. So this is all part of the, and also to uphold and promote equality, diversity, and inclusion when it comes to your clients. Very important. So this is all one of the standards, which is code of conduct. So when it says here, not this one, this one says identify standard. So this is one of the standards, which is code of conduct. So let us go back and talk about it. So code of conduct, it's all about the agreed ways of working for you as a social carer. It's all about the way, the agreed ways of working. So for each healthcare should be accountable for their actions and always can answer if someone asks them about what they've been doing, and also to be honest, and whenever they do any mistake, they go and tell their manager. And also part of the code of conduct is to promote the privacy, dignity, and rights for the people you work with. Another point as well is when you work together with your colleagues, always ensure that you provide high quality, safe work, and also compassionate work. So you're always kind to your clients. And also it talks about communication. So communication should be always effective to promote health and safety and well-being for the individual who use health and social care. Communication is very important, and you need to respect your clients, respect their confidentiality when you work with them, and be committed to improve the quality of healthcare. Continuous, which is continuing professional development, which means whenever there is any training provided, you can ask for it. It's very important. And last thing in the code of conduct is upheld or promote equality, diversity, and inclusion. It's very important to always promote equality, diversity, and inclusion in your workplace. So we talked about code of conduct. This is part of the standard. So the other standard is the care certificate. This is set of 15 standards commonly used alongside with the code of conduct. So at work, you always use the care certificate and the code of conduct for health support worker and adult worker. It's very important. So as worker are introduced to these standards as soon as they start working, and they should follow these 15 standards. Okay, where is figure 2.3, which is here? So the 15 standards are here. You can write about them as well. First of all, you need to understand your role. Then, second thing, your personal development, to continue your personal development. Number 3 is your duty of care. Number 4, equality and diversity. Number 5, work in person centered way, and communication, privacy and dignity. Sorry, I can't see very well. The font is not. So, fluid and nutrition's awareness of mental health, dementia, and learning disabilities, safeguarding adults, safeguarding children, basic life support, health and safety, handling information, and infection prevention and control. So this is all 15 standard for care certificate. So if I was going to answer this question, I would say, where it says identify standards. So first of all, the first standard is sorry, let me go back. So first standard is code of conduct, and we just spoken about code of conduct, all these points. And then second one, which is the care certificate. Just say the care certificate is identify the way we work in the United Kingdom, which is 15 standard we follow, and just put the names for all these standards. And number 3 is minimum standards. The minimum standards refer to the knowledge, skills, which is required from any care worker. So we all should have minimum standards. And the quality care, the Care Quality Commission, they have minimum standards for us to follow as carers, which is first of all person-centered care. So what does that mean? It means you put your client in the center of your work. Always think about what this person needs, what this person would make him happy. So the adult carer must provide care that meet the individual's need. You don't just do things because you have to. No, some of the people, they need some maybe extra help because they can't move. So you put your client in the center of your work, and also you respect their dignity. And so as an adult carer, individual with dignity and respect at all times. So you respect their dignity, and also consent. We talked about consent because you need consent from the person to provide certain type of care for them. So you make sure always have consent from people. And also safety. Adult care worker must promote individual safety at all times. So you always make sure that your client is safe and secure. Safeguarding from abuse. So you need to make sure that your client is safe from any abuse that they might have. Food and drink. As an adult carer, you must ensure that the individual, which is you are supporting, are always maintained in terms of food, drink, all their requirements are there, and also in terms of their well-being. Premises and equipments. So adult care must ensure that equipments used for the provision of care support of the individual to support them, they all fit for purpose, keep it clean, stored it in a good way to keep it safe. So this is part of your duty. So whatever you work with, like any kind of equipment which is helping, let us say this person you care for is sitting on a wheelchair. So this wheelchair needs to be safe at all time. Make sure it's not broken, make sure it's clean, make sure it's being kept in a safe, not outside area. So this is your duties as well. And also complaints. What does it mean by complaints? Complaints, adult care worker must ensure that to follow their care setting agreed ways of working when individual complain. So whatever your client will complain, you need to record it properly. You need to pass it to your manager. You need to follow the policy and procedure. Whatever the policy and procedure tells you when people complaining, you shouldn't just ignore the complaint. No, you need to follow it to the exact, write the details, collect the evidence, pass it to the manager. So all this is very important. Another standard, which is, so let us go back, just recap for this standard. So this standard we talked about just now is minimum standard. This is minimum. So anyone should at least do this or follow this to be a good healthcare, which are the person-centered care. So you need to put your client in the center of your work and always think about their needs, about how they feel and how they act. Also, you need always to respect their dignity and get a consent from them whenever you provide any support or deal with their issues. Always get consent from them. Also, you need to make your clients safe at all times and don't put them in any risk or danger. Also, you need to safeguard them from any abuse. So if you can see any abuse marks or any, so if you see any person being abused because you work for to take care of this client. So if this person, you can see any mark of abuse, you should report it at all times. And also, in terms of food and drink, adult care worker must always ensure that your client always have sufficient food, drink, always there maintain and also make sure of their well-being. About the premises, as adult care, what's your responsibility is always to make sure that these equipments are always safe, clean, doesn't have any damages, and stored in a safe area. And also, if there is any complaint, you need to report it to the member of staff, which is your manager normally. And also you need to follow the policy and procedure about handling this complaint, like recording the complaint properly and pass it to the appropriate person. So this is another standard, which is the National Occupational Standard. What are the National Occupational Standard? Do we know what are they? It discusses all the required knowledge, skills, values from the health and social care worker, and also discuss best practice in different areas of work, and also basic training for anyone who work in the care should be at least level 2 diploma in health and social care. And also discuss the standards that each worker should follow to provide excellent healthcare. So now, if you were going to answer this question, which is 1.2, identify standards. So this is the standards we just talked about, which are, let me go back from the beginning. The standards are, first one, which is the code of conduct, and you need to talk about it as we spoken. You put all these points, and then you don't need to write everything, just write whatever you understand from our session, just put it down, read the book, put your notes as well. And then you need another standard, which is the care certificate. As we said, there are 15 standards, which are, and just put them all in. Just write it down and then say that they are very important for any adult care worker who works in the United Kingdom. And then third standard, which is the minimum standard, which means is the minimum requirement by the Care Quality Commission for any health and social carer to work in the UK to take care of the adults, which are personal center and all these points as well. You can put it write it as well down. And then the last one, which is not the last one, there is National Occupational Standard, and this one for all about these, which is the required knowledge and skills for the person to work in the child care and health and social care. Also the best practice in different area of work. They discuss also basic training which we need, which is level 2 diploma in health and social care, and also the standard which we follow to work and provide excellent care for our clients in terms of good communication, taking care of them, security. So all these are our standards. Second part of the question, it says regulatory requirement and agreed ways of working. So first we need to know what's the regulatory requirement. So what are the regulatory requirements? Can you think about regulation for us to work as a health and social carers? What are the regulatory requirements? So the rules or regulatory requirement is set by the law. It's all about influence the way that adults care workers can carry out different tasks to take care of their client in the care setting. And these are set by the Care Quality Commission. It's all about how to provide effective caring, how to provide safe environment, how to be responsive to people, how to take care of their well-being, and also how to fill their documents and find and create reports about them. So this is the regulatory requirement. So the regulatory requirement, it's set by law. It's all influence the way that adult care worker can carry out duties in the care setting. About how to keep the people safe, how to work effectively, how to take care of them, what the people need, how you can make sure of their well-being, and also how to write their documents and how to create and generate reports. So as you can see here, we have two regulations. Maybe if we keep, like, for me, because you are level 2, for us now we understand what's the regulatory requirement, what's the standards. So if you just write the heads, like for here, like number 1 is for the regulatory requirement. You talk about the regulatory requirement, just put the heads, the bullet points, like the CQC, which is the Quality Care Commission, check care and support. So it's all about how we deal with. Yeah, that would be too much if you can start writing about everything. For you, did you understand the standards?
Yes.
Okay, good. So if you just expand on the standards, because they are easier to talk about, and then when you reach the regulation, where is it? The regulatory requirement, I will be saying that the regulatory requirement is set by law. It influences the way that we work as an adult carer in the United Kingdom. We should all follow the Care Quality Commission, and this set how we start providing the care, how we provide safe and support effectively, how we become responsive to the people that we work with, and also how we care for their well-being. And also it discuss how we fill the documents and care plan, and how we generate reports. So if you say this, that's enough for the regulation. Yeah?
Okay.
Because as you can see, they're all similar, and if you start writing about them, it will confuse you. You can just put regulation number 10, which is dignity and respect, and also regulation number 12, safe care and treatment. So regulation number 10, dignity and respect. This regulation, adult care workers are required to treat individuals with dignity and respect at all times. So according to this regulation, we should always treat our client with dignity and respect, and we treat them fairly. Also, the regulation 12, which is safe care and treatment. Under this regulation, adult care workers are required to have the necessary competence to ensure individuals are safe. So what's the from harm and from danger? So under this regulation, we all, as an adult carer, should follow the required from us, and to have the necessary competence, so we ensure our clients are always safe from danger and harm. How we maintain the standard, or how we become competent, is by following the training. Always, that's why you can say I'm studying my level 2 health and social care, to be competent and to follow the standards. So here where it says standards, so we have the standard, regulatory requirements, we just done it, and then the agreed ways of working. So what are the agreed ways of working? Do we know what's the agreed ways of working? We've spoken about this before.
Policy and policy officer.
Yeah.
Yeah.
Perfect. That's really good. So whenever people ask you what's the agreed ways of working, just say the policy, procedure, and guidelines. You follow the guidelines, you follow the policy, you follow the procedure. That's it. This is the agreed ways of working. So when it comes to agreed ways of working, you need to say in any adult care place, we always the carers always should follow the policy and procedure, the agreed ways of working, which are, first of all, policies such as safeguarding, health and safety, risk assessment. All these are policies. Also, the procedures. Procedures mean the way we handle the things.
Okay.
So the procedures such as moving, handling, assisting our clients, and also personal hygiene.
Okay.
And the guidance, such as how to support the individual with their mobility, how to communicate with them, how we provide specific communication needs for some of the clients. This is all should be set by the care itself. So every care home would have different, well, very similar, but you need to, they are similar in terms of they're all about safeguarding, they're all about health and safety, they're all about risk assessment, but you need to read it because the points are very important for you, so it can give you extra training. So as we said here, so the third part of the question, 1.2, which is the agreed ways of working. So you go back and check what are the agreed ways of working. Just say there is in every health and social care, they have different agreed ways of working, and everyone should follow to make sure that their work is, they do the best and they provide excellent care and support to their clients. And these agreed ways of working are policies such as safeguarding, health and safety, risk assessment, also procedures such as moving, handling, assisting, and also personal hygiene, and guidance such as supporting individual for their mobility, communication with individual, and there are some specific way of handling communication if the person has extra special needs. And also best practice. Best practice is mean the best way you follow it to provide excellent care. So the best practice is all about how to involve individual and their families in care and support planning, or how to promote healthy eating for the individual. So best practices mean it's all about providing excellent care and support, how to involve the person or his family in their care, in his care, and also provide healthy eating for the individual. So this is all for question 1.2. I know it's long, but let us write as much as we can. It's very good because the awarding body would come, check your work, and then think like this person provided excellent work. So if you have one of the unit is not really, or maybe they wouldn't even check, to be honest. Like if you have 4 or 5 excellent units, they will be like, yeah, pass. Because why? Because that means it's a standard that you follow in. Every unit is a very good unit, and I can see your work. I'm very, very happy with all of you. Why? Because your work is developing from good to better, from better to the best. Slowly, slowly, I can see unit by unit, you're getting better. So now if you want to answer this question, explain why reflecting on work activities is an important way to develop knowledge, skills, and practice. So how you reflecting on your own work would develop your work. So if I go to the book 2.1, can you think about this question? How you reflect on your own work would develop your work? Anyone to answer this question? So, for example, you done something. Let us say you done a mistake at work, and then you gone home. So when you go home, you would be thinking about what you done. Then you think, okay, well, I think this was a mistake. I shouldn't have done it this way because my training was a totally different way of doing this same practice. Then you start thinking about how to develop it next time. Why this person was so unhappy with you? Maybe you done it correctly, but then still the person is still unsatisfied with your the way you presented the food for him or the way you handled his complaint. Or so when you go home, you think about it, and then you start developing ideas about how to do it better next time. So reflecting on your own work is really, really important. So to reflect meant to think, and being able to reflect is very important for your skills, because your skills will be developed, and your thinking, you will, because you're always honest to yourself. Like if you tell the same thing to other colleague, you might not be telling him or her the same way. While when you talk to yourself, you reflect on your own practice, you will be very, very honest.
Yes.
And this will be very positive, could be positive or could be negative, because you will tell yourself, no, I've done wrong because the way that I've been trained different from the way I handled this situation. And you're not afraid of like a question in your own work. So when it says explain why reflecting on your own activities can develop skills and knowledge. So first of all, you take a step back, think by day-to-day activities, and think about what went well, what went wrong. Also examine the details, the reasons why and how you carried out your work practice, and assess your knowledge. So you will be thinking, was me handling the situation correctly? If it is not, do I have the right skills and knowledge to handle it better in another way, another time when I face the same complaint or same problem? And then for you can identify your own strengths and your weaknesses. So whatever you have, like what's your weaknesses, what's your strength, you will highlight it by yourself. And also you will be identify areas where your work and practice that can be improved. Then you can tell yourself, no, I actually need training in this, I need training in that. Then you can get training, develop in different way in your work, and also develop new areas of learning, such as different or new approaches to the same situations might happen again in the future. So when you why the reflecting on your work is important? So can anyone tell me? Why it is important? So now we know what's reflection and how we can reflect on our own activities. Why it is important?
Because you understand what you make about. Yeah?
Yes, very good.
Yeah.
For you, you will be analyzing the situations, analyzing what you have done, and then you realize whether you done correctly or incorrectly. And also you will realize if you need the training, if you need support from your manager.
Yes. To be confident in your work. Yeah, if you want any.
So first of all, why it is very good. You know, even incorrectly, you still can't think like, oh, I need training in this, and then you go to your manager and ask for training.
Yes.
That's very good. So why reflection is important? First of all, we can talk a little bit about reflecting, about your own work. Reflecting is mean I need to step back and think about my own activities, whether I done right or wrong, and why I done it this way, and also think if I follow the policy and procedure. I also think do I need the training on that area? If I done them incorrectly, would I be doing better next time? So the importance for reflection on your work is, first of all, get to know yourself. So for each one of us will be understanding our own skills, our own behavior, which is very important. So when we realize that what we're missing, then we can improve ourselves in the future. Maybe handle the same situation differently next time. And also develop yourself. So by identifying opportunities to address, and that will increase your knowledge, your skills, give you a better behavior next time. So, for example, by assessing additional training in the care setting. So whenever you spot any mistakes that you had, then you will think, okay, I need more training because I don't know how to handle the situation. And if I face it in the future, I wouldn't be able to do it correctly. Then you identify how you can develop yourself. And also you can develop best practice by finding out about your work practice and approaches that are not working. You and your colleague will then be able to develop new ways of working. So that will develop best practice. So if you think about it, if you have done so many things in a different way, and it proved to be very good, it doesn't need to be when you reflect, it doesn't need to be all about mistakes. Maybe you reflect on it and think, oh, this is a better way of doing things. Then you can tell your colleagues and change the way you're doing things. So it develops best practice, which is by finding out the working practice and approaches that are not working, and also the ones which are working better in a better way. Then you can speak to your colleagues and change the way you are working. Yes. So this is how, sorry, where is it? So this is the answer for number 2.1. Explain why reflecting on work activities is important way to develop knowledge, skills, and practice. So you need just to think about why it is good for you to reflect on your work. So first of all, I would say, what is reflecting on my own work? Reflecting on my own work is I step back and think about my work and think about how I handled certain situations, what I done wrong, what I done correctly, and how can I improve it next time. And it is very important for every one of us to reflect on their own ways of working. Why? Because first of all, to get knowledge, to know yourself. So as a person, adult carer, I always check my knowledge and understanding by reflecting on my own work. And if there is anything I done it incorrectly, I will be try to do it better next time. And also developing yourself. And by doing the reflection on our own work, I can identify opportunities to address and knowledge which I need. I still need lots of knowledge and training. For example, in safeguarding, there I can ask my manager for training in safeguarding. I always spot opportunities by reflecting on my own account. Then I know what kind of knowledge, skills, and experience or training I need to do my job better. And also, it could develop the best practice by reflecting on myself. Why? Because if I keep thinking about what I've done wrong or right, then by finding out our working practices, then if anything is not working, then we can speak to my colleagues and maybe change the way we're doing things and the way we approach things to get a better care for our clients. So this is how to answer this question. How about identify sources of support and how they can be used for own learning and development. So, do you know where you can get support from? What's the resources for the support you can have in the workplace? Like, let us say you just started working, but you're stuck with something.
My manager, my colleagues.
Excellent, yeah. Very good.
Yeah.
Training,
yeah.
yes, very good. So what the support, the source of support that you can have to be used for your learning and development, to develop yourself, your professional knowledge and skills and experience, you need to get a range of sources, such as, so here, as you, Mariam said, your manager, your colleague, your an individual, which is the person you're caring for, they can have a lot more information about themselves, which we don't have. Then you can get more knowledge. And also your assessor, which is the person training you, and the standards in the care setting. Obviously, the policy and procedure, not only the standards, and the agreed ways of working in the care setting, policy, procedure, and guidance. This is all could be supporting you. So to answer this question, which is identify source of support and how they can use for own learning and development, I would say to develop myself as a health and social carer, I need many resources so I can give better care and support to my clients. And these resources are my manager, my colleagues, the individual person that I care for. They can provide me with lots of good information about themselves. Also my assessor. I can follow the standards in care setting where I work, and also I follow the policy and procedure and the ways of working, and to provide best practice. So, and when you come here, it says how they can be used for your own learning. I would say, what would you say? So like your manager. So my manager will give me will teach me how to do a better performance, will and also give me formal supervision, and with he will teach me how to do planning, monitoring, personal development. So this will expand my knowledge and skills and abilities. Also, you can talk about that they do monitoring in the organization to your work. Then you can get a lot more knowledge and skills from your manager. Your manager may also arrange some regular formal support meetings, so they will provide meetings with you, discuss your performance, professional development. They discuss training if you need. So it's the managers are always very good to improve your own working skills and best practice. Also, you can tell them about what you're facing at work, what type of problems are there, and then you can try to solve it with them. And also at the end of the year, the manager will create appraisal for every employee. Then this appraisal will have how much training you need. He will give you a feedback about your own work and how you're improving. It's very important to have the appraisal. So it's another source of formal support. The appraisal itself is a very good for formal support. Why? Because in the appraisal, your manager will be assessing your performance for the job itself, and also provide you with feedback about how you managed, what you managed to do, what was the mistakes you have done, and how you can improve your practice next time. And also I will give you and provide you with training, which is always good. And as we said, so that's the manager, how they can provide you with the support. Second thing are colleagues. So your colleagues are very good source of information, whether it's formal or informal support. They can provide you also with day-to-day work activities and knowledge. You might, especially when you first start working, so you need lots of information from them. Also, when you switch shifts, so you can maybe get more information from the night shift about the same client. Also, you can get information from the individual, like we said, which is the people who you care for. The individual can be a useful source of support and information, because you get and to improve your practice, because they can provide you with feedback about what you done correct, how you done it, and what you done, and how you can improve it next time, and because to match their needs. Also, training is very good source of information. Training you may receive from your manager on how to complete activities. Also, it may be that your manager has organized some formal training inside the care setting where professional trainer visit. So the training, you either get it from your manager about to complete any activities, or you can get it from external trainer. Maybe your manager will organize one day for training and then bring an external trainer. Then he can teach you more about how to do things correctly. Also, training can be on the job, where you learn new skills and experience, or through a training day where you can leave the nursing home, you can go to somewhere else to get one day full of training outside the organization. obviously, another source of resources or information, which is you can get from searching online, or from maybe books all about health and social care, and also through your course, the course you're doing with us, which is level 2 health and social care, because we will give you extra training. As we said here, there is as well as this the assessor. So for me, I'm your teacher at the moment, but I will come and assist you in your workplace. So I will come do a report about how well you've been doing the work, and verify your knowledge, skills, abilities. So for you to pass the course, I will at least need to come and visit you in the workplace at least once. So your assessor can support you with your further development and verification of your knowledge. So we'll verify your knowledge, skills, behavior. We'll tell you what went good in his visit or her visit, and they can provide you with access to useful information about the best practice. So they can tell you the best way of doing the same thing is by doing this. So they provide you with information about the best practice. Always very good and very handy. Also, the standards that you follow. The standards in the care setting where work can be useful source of information. And the care home. So you follow the standards, and you can read these standards obviously from the organization themselves. They would provide you with information about how to follow the standards. And also the agreed ways of working, as we said, it's a policy, procedure, guidance. This is all the agreed ways of working in the care setting, where your work can be useful source of information. So if you follow it, you will get your best practice. So it's always good and handy to follow these policy and procedure, because it will have pieces of the legislation that we all should follow as care worker. Okay, so now so these are all inside the organization. So when you come and answer this question, identify source of support, you say source of support, first of all, inside the organization, which we just talked about, is all this, and you can explain one by one briefly. And then there is another one, which is outside the organization, a trainer, which is external trainer. The manager could book to come for a day not to come to the organization. We'll book you, and then you can go, all of you, to somewhere to get this training with another training provider. So the trainers, as discussed, training plan a key role in your learning and development. And training is very important for both, if it is inside the setting or outside the setting. No matter what, any training provided, you should always take it. They can share with you the knowledge, skills, specific area of work, such as dementia care, planning activities, completing manual handling risk, maybe first aid. All these type of training is very important. So you can get this information from a trainer outside the organization, also from your family and friends. You must not forget the support you receive from family and friends. For example, financial support, with your study, and also personal responsibilities they do. So so you can have the time to study. And also the online forums. So these are on the website. Sometimes you see forums where people can keep discussing the same subject. Like you put, hi, please, I need help in child care in Unit 3, and then everyone will start participating. Lots of people will be answering the same question. So from online forum, you can get lots of information and support. And these provide support and suggestions on how overcome difficulties you may be experiencing. They're also a placing where people can share best practice. And last one is e-learning. Short courses you might have. Maybe your organization doesn't provide certain training because they think you studied it when you done your course with us. Then you can always go and take any e-learning, which means online course. So they are short courses to study, deliver information, and can develop your knowledge, skills, and abilities to do best work. So now describe the process of agreeing a personal development plan and how you should be involved. That's 3.2. Let us go to 3.2. Okay, so here is the 3.2, which is it this one? Describe the process of agreeing on personal development plan and who should be involved. So first of all, who should be involved? Reflect on who you would involve and why when agreeing on your personal development. So who do you think the person should be involved in your personal development? Obviously, it's you and your manager. It's between just you two. Your personal development is not related to anyone else. Okay? So for you, the one who should be involved is your manager. So between you, you would do appraisals, you would do training, you would do lots of things. Maybe you can approach them in their room and say, I need this kind of training. They will provide it for you. So for personal development plan, it's always between you and your manager. The process of agreeing on the PDP, which is personal development plan. First of all, so the process involves agreeing on this following 7 key points, which is, first of all, identify the skills, knowledge that are required to carry out your own job at the moment. So first of all, for you to identify which type of training do you need. Should I just go to the manager and say, hi, good morning, I need training? That's not enough. I need to tell him exactly what type of training I need. So first of all, I need to identify the skills, knowledge that are required to carry out my own work, which is following the job description. So first of all, you need to follow the job description, follow your own responsibilities, and check which one you can't handle it very well. Then this is part of your learning needs. Number 2, identify the skills, knowledge that you have at the present. You will need to gather the information you have collected from the people you have involved in your planning. So for you to identify which type of training you need, also you need to get feedback. So you will need to gather information by getting feedback from your colleague, from the people you care for. You collect lots of feedback and lots of information, get them involved in your training, and also identify any gaps you might have in your skills, knowledge, what it is required. So what is it required to bridge this gap? You will need to discuss and agree that with your manager and supervisor. So it depends. If it is massive organization, then you agree with your supervisor. If it is a small organization, the manager will be the one who's above you. Then you can discuss the training with them. Also, you need to set goals on how to fill these gaps. You will need to discuss with your manager what would you like to achieve, and then you create SMART goals. What is the SMART goals? It's all about the strength, the weaknesses you have, how to improve it. It's very important. And at the end, and was the timing needed. It's also agreed ways of working. You can bridge the gaps in your skills and knowledge depending on your agreed goals. So for you, with your manager, you will be agreeing on certain goals. You say, by the end of the month, I need to learn safeguarding, I need to learn first aid, because one of the client always have got epilepsy or certain seizure, and I need to take care of them. So you need, for example, first aider, or maybe there is no one in the care home have first aider training, then one of you would have to get it. So you agree with your manager about how to bridge this gap, about your skills, knowledge, depending on your agreed goals with your manager. And also you agree on when these gaps will be met. Timing is very important. You don't say with your manager, okay, I need this type of training, and forget about it. You need timing. Timing is very important. You need to agree on when this will be met. You and your manager will discuss and agree on what the need to be addressed urgently and what doesn't need to be set as urgent. Then you can have a realistic timetable for them, time scale. Let us say within 6 months you need to do this. However, some of the training is really urgent, then you need to do it as soon as possible. It depends. And also the last one, which is you review your goals regularly. So after 1 year, there is another appraisal you will do with your manager. Then you can check how many training you agreed on. Did you do it on time? Do you still need training? This is all you review your goals with on a regular basis with your manager. Discuss and agree on what should be done and whether it was done on time. Recognize what have already been achieved and what would you like to achieve next time. It's very important. All this in the personal development plan. So now if I was going to answer this question, it says describe the process of agreeing on personal development plan and who should be involved. So the process is these 7 points. Where is it? Okay. What is your personal development plan? So this is question number 3.2. Let's see. So as we said, so who should be involved in your personal development plan? You and your manager should be always involved in your personal development plan. The process about how to agree on your key areas. So it's here. What's the process of agreeing on your PDP? personal development plan. First of all, you need to identify the skills, knowledge that you require to carry out in your role, and whether you have these basic knowledge and experience to carry out your duties and responsibilities on the daily basis. Second thing, you need to identify what skills and knowledge you have at the present. So first you identify the skills and knowledge that you needed to do the job. Then you identify the skills and knowledge that you have already and how can you improve it. And then you identify the gap between these two. Identify the gap and how to fit this gap. So you will need to discuss with your manager what would you like to achieve and how you achieve it by doing a smart target, smart goals, and you reflect on your own goals you set at work. And then after that you set, and then you agree with your manager about how to bridge the gap, what skills of knowledge you need to do, and how what kind of training you need to take, and then you agree with your manager about timing to bridge these gaps. You don't leave it open end. You need timing. So you agree on when these gaps will be met, and your manager with you can discuss together the needs and when can be filled. And is it within 6 months? Is it within a year? Is it really urgent needs and you can't do your job without it? Then you can do it urgently. And last thing is you review your goals regularly with your manager. And you check your plan, what you want to do in the future. You will also discuss and agree with your manager or supervisor on the order the order of you achieving these goals or these trainings. When you're going to be doing these, have you done it? Are you going to need more training? This document, which is called appraisal, should be done regularly between you and the manager to assess your learning and training and development. Now describe how learning activities has improved on knowledge and experience. So how learning activities has improved on knowledge and understanding. So you went to training, even now you learned from this course a lot. I think this is unit 3. You should have learned quite a lot from our level 2 health and social care. So describe how learning activities has improved your own knowledge and understanding. So this is all about yourself. This should be, I should put it in the reflective account. This should be all about you. So I'm going to highlight it red and put it with the reflective account when I send it to you. So how would you, because it's all about you, your own. When you see your own, you start talking about yourself. So describe how a learning activity has improved on knowledge. Just bring any learning activity, one learning activity. Can you tell me one learning activity and how it improved your working skills? That's 4.1. Okay. So as you can see here, what's the learning activities? We talked about training. for example. Just say you had, for me, I can answer in a different way. I can say, talking about myself, I had lots of training, so you need to describe how a learning activity, so one learning activity, you need to tell me, has improved your own knowledge and skills. There are so many types of learning activities, so we can talk about, for example, training, learning programs, which is, for example, this is what we're doing now, level 2 health and social care, mentoring programs. So when the manager was mentoring you, what did you learn from that? Coaching programs, reading and information sharing, and also reflection. So and visiting other setting. So for me, I can answer before I started work in my own nursing home. At the moment, I want to do volunteering work in another care home. When I done this volunteering work, I learned a lot. This has changed my skills and abilities, because it has improved my skills and abilities, because I start watching them, learning how they used to take care of the person, the client, how to feed them, how to bath them, how to talk to them, how to put them in the center of their activities, and how to think about creating a safe environment for them. And I learned a lot. This has improved my working skills, and now I'm using everything I learned from my voluntary job in this workplace where I'm working in at the moment. Is this like, is it easy? Yeah, I don't think it's difficult. Just you need to talk about one learning activity. Let us say you had a training for first aider, and now you're using first aider a lot whenever they need it in a workplace. Just you need to talk about it, how it helped you at the moment in serving your customers. Or maybe you can talk about you studying at the moment health and social care level 2. From unit 1, you learned a lot about communication and how you do communication with the client, and how to provide the best way to communicate with them. And now you either write to your client if they don't talk, or also some of them, they don't like talking too much. So what you do, you just use signs to them. For example, you show them a sign about how to use a cup, how to bring, if you want to bring them tea or coffee. Some of them you learn now you have to bring a translator. So you had one of your clients who doesn't speak with you that much, and you find out that this client is she's talking totally different language. Then from this course you learned how to bring a translator. You contacted one of your colleagues, you spoken to her, and now she's translating for you. And this has increased the trust between you and the client, and now she finds you really helpful because you are using a translator for her. Something like this. Just tell us about your experience. Describe what did you do, just one learning activity. Is this understood?
Yes.
Okay, excellent. You can bring any example.
Example, yeah.
Yeah, exactly. Or for example, you say when you started working, you had your manager was mentoring you, was helping you throughout the way because you had little bit of knowledge, and then they start showing you how to do things correctly with the clients, how to sit with them, how to talk to them, and now how to handle and manage difficult situations. And now you find it a lot easier to deal with the clients because you have a lot skills and knowledge about how to handle them.
Yes.
Any example that can fit for you. Now, if I go to the question after that, okay, we have just the 3 more questions. And then the reflective account. So this question says, describe how reflecting on a situation has improved on knowledge, skills, and understanding. So this is, again, this is reflective account because it says on. Can you see? So you talk about you. You say I. You don't say the healthcare should do this. No, you say I should do this. So describe how reflecting on a situation has improved your own knowledge. So can you think about any situation? Let us go to the question and see what the book have got here for us. 4.2. We have some examples here. An individual may learn new skills. An individual family may provide their support. You may want to try new activities. An individual may have a fall. So you need just to reflect on your own knowledge and experience. So how reflecting on a situation has improved your own knowledge. Can we think about the way that we any situation? So as you can see here in the book, it says a client may have a fall. So let us talk about this. I say in my care home, I do my activities very well. I always follow the policy and procedure. However, one day I had one of my clients was moving fast, and he fell on the floor and hurt himself. And when I went home, I kept thinking about what happened, why this person has fall off, and why did I allow this to happen? And I found myself was not doing my job properly, because this person should have been guided, because he walked on a stick, and on that day the stick wasn't near his bed, so that's why he fell off. And then I kept thinking about how to handle the situation correctly. And I thought I would put the stick next to his bed, so whenever he wake up, the stick is there, it can take it. And also I told him in the morning that whenever he needs to get up and go, though I encourage them to be independent, I still need to help them. So I said to him, whenever you need to go and you feel you can't do it yourself, please call me, I'm always around. And since then, this client started calling me. This has improved my knowledge that I shouldn't keep the client on doing things on their own. Though I like them to be independent, but still I need to help them, provide extra support and help to them. And this has improved my skills and abilities in handling and dealing with another clients.
Okay.
Yeah, so you can answer it this way, or maybe another situation where you have improved as well. Like, let us think about another situation where one of your clients, for example, you say, as a health and social carer, I work well with the clients. I make sure they always, I make sure always I do the best for them. However, one of my clients, one day, she stopped talking to me for quite a while, for the whole day, and she didn't like to eat, and she didn't like. So I just left her because I thought she should be independent and she can pick up for herself. But when I went home, I thought maybe what I did was wrong, because though we have to leave them to live an independent life, but we are there always to support them, to help them. Maybe I should have spoken to her to understand why she was upset and why she wasn't happy at this very moment, why she didn't like to talk to me. Was something I done wrong? So I learned from that time. So I went in the morning and spoken to her and sit with her on the bed and try to keep talking to her until she started. I asked her if that was my fault that she didn't want to talk to me. And then she started talking that she was not happy because one of her son didn't come and visit her. Then I realized it was not my mistake. However, I should have spoken to her from the beginning, when I found out that she wasn't talking or even eating. And since then I start, whenever I see anyone of my clients sitting quietly, not talking, not responding, I start to try to be more communicative with them, sit with them, try to keep talking until I find out why they are not happy, and try to fix the situation for them.
Yes.
So this is another way of improving your skills and knowledge from one thing you learned or a situation has happened to you.
Yes.
Okay, now explain the importance of continuing professional development. So what is the important? Why is it important for you to continue your professional development? So for me, if I don't continue, like, okay, I graduated from level 5 health and social care, and I'm teaching now. Would that mean I shouldn't be improve my skills, abilities, and that's it? I don't need anymore because I'm teaching. No, you need always to get more knowledge, more experience, more new things, because everything is changing. Everything is getting better because we gaining more knowledge about things. So we need to learn. I always do my research, go to online, get more information about things. I read books. And same here. So what's the importance of continuing professional development? So continuing professional development, CPD, refer to the process of tackling and documenting the skills, the knowledge, the experience that you gained, and or the ones you need to improve. And it is recalled to what experience learning could apply to your work. And also looking at the skills and abilities, so you can check what you need to improve in the future. So now, maintaining and reviewing and updating your professional development throughout your career will help you in so many ways. First of all, it will improve your knowledge and understanding. Your knowledge of specific areas of work will increase because you have clearly outlined the areas you want to increase your knowledge and understanding. So for you, you always need to do the CPD, because this will improve your knowledge and understanding further, and also will improve your skills. Your skills develop because you clearly outline what you still missing, and you start going and taking training more to gain better skills in the future. So it is very good and very important to gain more and improve your skills. Also, it improves your work practice. Thinking about your work practice, let us say you're working in home, then you always need to keep learning new things. So thinking about your practice how you are progressing, or how constantly you're thinking about ways to improve. That will mean the practice is more likely to meet the requirements for the work activities. So you constantly need to improve your work. And that's by the continuous development, training and development, and also help you apply new working approaches. So when you continue your learning and development, as you think about your practice, you may identify new ways of working, and you will gain understanding of how a new and effective work approach is. So because if you keep thinking about your work practice, you keep developing, you might find out there are new ways of working. Then you can do it with your colleagues, with your individuals, and then that will improve ways of working. And also it will help you to adapt your practice. As you will learn a lot about your best practice and how to apply it, include using different skills to change the way you practice to ensure it remains up to date. So it helps you update your practice, will keep you up to date with the new skills and abilities in the world. Everyone should be developing their skills, and also help you develop your job role. So you got your job role, you follow it to the exact. However, sometimes you need to, some of the clients would need some other things. So by you doing the continuous training will increase confidence when applying this knowledge and skills and the things you learned with your clients. They will increase their confidence in you. They will may lead to explore different jobs role. So when you're confident in yourself because you learned a lot and you're still learning, you would think, okay, I want to do managerial role next time. Maybe I can be a supervisor because I have the knowledge that my supervisor have. Then I can apply to be a supervisor when she or he leaves the area. So this will increase your confidence, your client's confidence in you, and also your confidence about yourself. And it will provide you with an opportunity to reflect. So new training will help you to reflect more about yourself. What's your awareness? What's your knowledge, skills, behavior? This is all will increase, and then by doing this further training. So if you were to answer this, where it says explain the importance of continuous professional development, I will be just doing, where is it? It starts from here. Continuous professional development will help me to expand my knowledge, skills, and abilities in the job in the future. And it will, number one, improve my knowledge and understanding. And try always to say my and I. It's very good, even if it is not reflective of practice. Why? Because if you can, because this shows that you have the knowledge yourself. It's not like you copied it from somewhere else. It's really good. So first of all, it will improve my own knowledge and understanding, and that's in a specific area where I increase more, get more training, will give me better understanding of the of these areas in the workplace. Also, it will improve my skills, because by me getting extra training will give me a clear outline, identify the way which I can improve my work and gain new skills. And also this will improve my work practice, thinking about my own work practice, the progression for me is I'm constantly getting more training. I'm getting more getting better skills and abilities. This will also improve my own work, my working area. Also will help me apply these new work approaches to my own work. So as you think about your own practice, you may identify new ways of working. You will gain understanding of new and effective ways, working approaches, and that will improve the work in general. Also will help you to adapt your own practice. So when you gain more training, will help you to improve the best practice in the organization, because you will use these skills with your colleague in the workplace. And also will help you develop your job. So for you, it will increase your confidence. So when you gain more training, you will have more confidence in what you're doing, in your skills, in your abilities, and that will make you think about yourself and aim higher, maybe become a supervisor, maybe become a manager. So it is very important to improve your skills. Also provide you with an opportunity to reflect on yourself. So when you gain more training, you will be thinking, oh, that's why my client last 2 weeks wasn't doing this or doing that. So you, because I really wasn't maybe taking him to the garden because he was telling me to do, or you just start reflecting because you gain more knowledge. So it's very good to gain extra training. You gain extra self-awareness, extra knowledge, extra skills, will improve your behavior, and all this will reflect on your development in the future.
Yeah.
Now, the last question from this sheet before we go to the reflective account: describe how feedback from others has developed on knowledge, skills, and understanding. So on knowledge and skills and understanding. So this is again its reflective account because it says here on. Can you think? Can you see? So that's again reflective account. So how feedback from others developed on knowledge, skills, and abilities. So if I go to which question is that? 4.1. Let's see what the book has for 4.4. So as you can see, they give you an example. You can write something similar, but it's all about yourself. So this person who is support worker and have got lots of wishes, choices. She always enable her clients to tell her what they like, what they don't like, and also that she remains as involved as possible in their own care. And Lucinda supported Frank, so who is recently being diagnosed with Alzheimer's. So now she starts talking about her client who's got Alzheimer to meet his social worker to discuss his current and future care needs. So she arranged for the meeting first of all, and then she took Frank to took Frank to his flat to make him feel relaxed. And once the social care worker arrived, then Lucinda supported Frank to make everyone a cup of tea, supported and discussed by saying that Frank had written an account a few days earlier about what he enjoys and what he likes in his life, and what he likes to change. And what's Frank dream? So Frank handed his written account to the social worker. So Lucinda checked with the Frank that he had understood the questions. The social worker asked him questions. He didn't understand it. Lucinda checked with him if he understand it. And then the next day, Lucinda received a phone call from the social worker who explained that she liked the way that she had dealt with Frank. Because she also arranged another meeting, and later this afternoon, Lucinda attended a team meeting. Then Lucinda shared her experience with the manager, answered their questions with her colleagues, and the team praised Lucinda on her achievements. So you give an example about yourself. I can just write something very similar to this. I say I am working as a carer for one of the ladies who called Leticia or Linda or any person you want to care for, and just start talking about she needed support to go, for example, shopping. Then what did you do? You arrived early to her house. You gave her a accountable and asked her if she had something to eat for breakfast. She answered yes. Then asked her, do you want me to cook you something for lunch? She said yes, please. So I cooked her something for lunch, and then I opened the windows to get fresh air. Then I asked Lucinda if not Lucinda, Linda, if I put a shopping list. I got exactly what she wanted on my list, went to the shopping center, got her everything, arrived back on time. I didn't take long time to get her everything. My client was very happy, was very satisfied. She got all her shopping, and also she got me back on time fast. And I asked her, do you want to have a bath? She said yes. I gave her a bath, and I came and sat with her for a while. She was really satisfied. She told me that what I done was perfect. I didn't take my time, a lot of time to do the shopping. I done all the cleaning for her, even though I asked just for simple things to do for me. And also you've been really. She told me that I've been really amazing with her. I treat her really nicely. I took this feedback when I went the second day in a staff meeting. I shared my experience with my manager and my colleagues, and they appraised me for my performance. Something like this. Or you can say the same example you have. Just write it about yourself. Yeah.
Okay.
Okay, excellent. So this is the last question from this sheet. Let us go to the reflective account and to see what we have. So now you need to talk about your own roles, your own duties, how you manage your work. So we've spoken about this in the beginning of the day. So now when I send you the recording, you will find it when we started talking. which is describe your own duties and responsibilities of your own role. So if I talk about this about myself, I will say as a care worker, I work in a nursing home. My duties are ensure high quality of support that I provide for my clients. I encourage them to tell me what they would need, and I always do it for them. I always make clear that expect from me on a daily basis. So I know what's my job description. I follow it to the exact, and also I ensure my so what's my this is my duty. So if I go here, my duties, this is better because this is smaller, so you can talk about yourself. Say my duties as a care assistant. My duties in the care home is to provide assistance to individual when required about their care task, and also what I do there is showering them, maintaining their personal hygiene. I also prepare meals. I manage their money. I do some shopping, attended their any health appointments with them, and also I maintain a daily record. I write in their care plan what they have achieved, what they've done, and also I support them if they have any meeting with any doctor or any social carer. I go with them and support them, and also I take any training as required from me. That's my duties, my responsibilities, because it says what's duties and responsibilities, so you need both. So, and as a care worker, my responsibilities is to respect the individual right to make their own choices about their own care, and also I respect their independency, their privacy, their dignity at all times. I also make sure that I always do a very good communication with the individual. So if they need if they have any extra requirements in terms of care, I provide it for them. If they need a translator, if they do sign language, I always make sure I follow this. And also I ensure confidentiality when I maintain, always maintain for my clients. And also I ensure all records completely accurate, and I handle it in a timely manner. So this is your own. Obviously, if you think about more responsibilities or duties, please put it down there as well. But it's very important you write what's your duty, what's your responsibility, and it's all about yourself, because it's reflective account. You reflect on your own skills and abilities. Assess how well on knowledge, skills, and understanding met the standard. This is what we just discussed. We discussed this, didn't we? Do you still remember? So if I go to 2.2, okay, that's 3.1, now 2.2, what is it? Okay, so how would you assess your, how you can, like, To assess your own knowledge, skills, and abilities, you need to do reflecting. You need to do evaluating. Yes?
Yes.
So how you assess your own knowledge, skills, and understanding? So for me, I say as someone who work in care, I always make sure I check, reflect on my own knowledge, skills, and understanding to check if I meet the standards. So it is very important that I keep closely checking out my knowledge, my skills, and abilities, because this will as a continuous development for me, for my work, and also to ensure that my clients are always safe. I always make sure of their well-being, and also maintain safe practice. So the environment is safe, my practice is safe. And I do that by, first of all, I reflect on my own practice. So I spend the time thinking about the knowledge, skills, and understanding, and how can I meet the standards. And if I didn't meet it, then I need to think exactly what went wrong. So first of all, you reflect on your own practice. So spending time thinking about the knowledge, skills, and understanding of my own work, and after that I evaluate my work. So I spend time assessing my attitude, my behavior, what went wrong, and how can I deal with it and handle it better next time. Is this okay? Understood?
Yes.
Okay, excellent. Now demonstrate the ability to reflect on work activities. So how can you reflect on your own abilities? Can you think about ways to do that, like without even looking at the book? So how will you demonstrate abilities to reflect on your own work? So for me, I just say about myself, and then when you talk about yourself, just say I'm always try to step back and think about my own work, how I done it, whether I done it correctly or in a wrong way, and why the outcome of my work. So I reflect on my activities. And that's because this will give me self-awareness about how I can, how my behavior has impacted my own work. And always I'm honest with myself when I think about the situations. And even when I'm wrong, I can tell and I can improve my work. Also, I have commitment because I need to continue improve the quality of my own work. That's why I keep doing reflection. So what's your ability to reflect? So I can bring an example. As you can see here, the book have given you an example. It says introduction, about your reflection and what happened, and what worked well, what didn't work well, and how can you improve it next time. And also, okay, so for me as a reflection example, I would say as a care worker, I work an activity worker in a activities worker in a daycare center with all the adults. The activities individual encourage them to develop new skills, insist to and develop them provide them with opportunities to meet other people. The activities I carry out will depend on individual need linked to preferences. They include one-to-one activities such as play, Scrabble, and individual talking about their backgrounds in groups. Yesterday, I carried out a cooking activities with a small group of 3 individuals. The 4th of us met last week to plan what the activities would involve. We discussed what to cook, and everyone agreed that they wanted to bake some biscuits. We agreed on the recipe. Following that, what we need, and we made a shopping list for all the ingredients needed because of the recipe we have found, and that equipment we would need, and so everyone agreed that they wanted to bake their own biscuit, and we would all go shopping together on the day before the activity. Cleaning up after the activity was what we need to be everyone's responsibility. In addition, I agreed that we have overall responsibilities for the activities and provide any help with carrying out any activities for individual required. The cooking activity went very well. Everyone seemed to enjoy it themselves. Work well together. Once the biscuit had cooked down, these were placed separate plates with a nice cup of tea given to the clients. I was so happy that everyone was so enthusiastic about taking part, both planning and taking part in the activities. One of the individuals in the group did not want to taste any of the biscuit, not even her own one. So, and she had taken so much care for producing the biscuit. After the cooking activities, I met individual who did not want to taste the biscuit, and she explained that she did not want to do so because she had spotted one of the members in the group dipping her finger into the cake mixture before they were placed in the baking. After what happened, I think next time I will need to provide a lot more information to the group about the food hygiene before we start cooking. So this is a way about how to write your own. So identify where are we? Sorry. We demonstrate the abilities to reflect on your own work. So you can just say this or reflect on any other activities. So for this person, start talking about what they do as a start and then what they did on that day. So just you need to write it this way, just like this. I work, I did this. So our activity was, for example, let us think about another activities that some of them wouldn't want to participate. Maybe singing a song, and one of them didn't, and you planned this on the day with your colleagues. You prepared a recorder. You made an risk assessment that the area was clean and clear for the client to sit. Then we sat down, we start singing, we put the music on, one of the clients didn't want to sing, so we finished everything. Everyone was happy, was very enthusiastic and encouraging to do it again. Then after this activity finished, I sat down with my clients who didn't want to participate in the singing, and I asked her, why didn't you participate in the singing? And then I found out that it's her, it's a religious thing that she doesn't want to participate, because people in her religion do not like to sing. Singing is forbidden, for example, and then it's not forbidden, it's not really liked by, for example, Islam. Then you realize that next time you might have to provide different type of activities to suit everyone, because not everyone can participate in the singing activities. Okay, so this is how you reflect on your own work. Just talk about yourself. So now if I go to here, contribute and agree on on personal development plan. So here I'm going to send you a personal development plan, and you will be just writing down what training you need. This is easy. This is, you don't need to write, you don't need to do research, just write about yourself. So if we go here to 3.3, let us go to 3.3. Okay, so what I'm going to send you, like this personal development plan. So you put your name and then the date you completed it, and put your organization, just put any organization name you would like to work with or you will be working with at the moment. And then what are my strengths? Just write about yourself. I'm compassionate, I'm reliable, I'm very responsible, I take care of my clients, I'm very passionate, very caring, always make sure of my client's safety. Just write about what you think you're very good at. And what are my weaknesses? And what do you need further development? Just think about your own skills. For me, for example, I still need first aid training. I don't have first aid training. So you can write about what you have as a weakness. Let us say you still need extra training in medications and how you give medications to the clients, and to hand, or maybe manual handling. Manual handling is a specific training program not everyone has, so but they should have it when they start working, if they deal with the clients who are not able to move easily from their beds. So you can talk about any weakness you have, and what further, or any further training you have, and write it down. Also, what opportunities are there available to me that can help me learning and develop? So you need to think about your own job. What's opportunities there for you? So you can talk about your own self, like you can say, can you think about opportunities that's available for you? Just say you've been working with this health and social, and then with this nursing home for a year, and you've been doing really well. Your manager is always appraising you, and you think that further opportunities that you need to do is going to a supervisor role. Or maybe you say, I just start working with this nursing home, and I feel like further opportunities that I need a lot more training, maybe coaching from my manager, then I can get better in what I'm doing. Also, what are the threats that you have in your this is all about yourself. So what are the threats? The threat that at the moment I'm working with a person who's got diabetes, and I don't have enough information about diabetes, and it's really could be dangerous. So I asked my manager if he can provide me with extra training and support, so I can provide extra help to this person. Or what's another threat you might have? A threat, you need to have more training, because you feel like you're some of the clients might suffer because you don't provide excellent support for them. Maybe talk about diabetes person, or someone who's got heart problems, and you don't know how to handle the situation sometimes, or someone who's got epilepsy and you don't really know, and you feel you're threatened from inside because you need to do your best, but you can't make it. And what's your goal? So what do I want to learn? So for you, you just write the learning programs you have to do, like handling, manual handling, communication program, first aid training, any other training you need to do. Also, what do I have to do? What do I have to do? So you just talk about yourself. What do you have to do? At the moment, you're doing your job properly. However, you still need to learn how to handle some certain situations. And now you are asking your manager. So first of all, what do you need to learn? I need to learn first aider. I need to learn manual handling, and I need to learn how to handle some certain difficult situation. What do I need to have? What do I have to do? I normally go and speak to my manager to inform them about the guide, and we discuss that together. And then what support will I need? I need a lot of support, especially I just been hired by the organization. So my manager is coaching me at the moment, helping me, and I still think I need some more training so I can handle difficult situations. How will I assess and evidence my achievement? I always do reflective practice, and I always reflect on my own work to check if I've done it correctly and how and when, and also if there is any opportunity to be improved next time. What my largest date of achievement and reviewing my progress. Target date. Just put any date. Let us put it at the end of the course. Let us say by 1st of July will be my review for my progress. What are my short-term goals in the last 12 months? This is all about you, your personal objectives. I need to finish my course, level 2 health and social care. I need to study level 3 health and social care. I need to go to the university. I need to find a job. I need to get a very good job in a hospital. That's why I'm studying this course. This is all about yourself. What are my medium term goals in the next 2 to 3 years? So what's your next 2 to 3 years, I can see myself graduated as a nurse and working in maybe a hospital. I would love that, for example. Or I can see myself working as a health and social carer in my nearest care home, and all the clients really like me and my manager really appreciate my work. What are the long-term goals? Long-term goals, this is for yourself. What's your long-term goals? To be a manager in your area, to gain good salary, to gain all the clients will like you by then, and all your colleagues. So what's your long-term goals? You can talk about it. Outcome, did I achieve anything you agreed on a time scale? Just what did you achieve? You achieved, first of all, you register for the course, which is level 2 health and social care, and also you're in a progress to finish this course, hopefully faster, and then you will maybe go and study level 3 after that, or maybe go to the university. Just you put the outcome. Did you achieve outcome you agreed on the time scale? Which means, let us say you said to yourself, by for the moment you just put yes or no, but later on when you work, you will be having, every year you will have the same appraisal, and then you can decide whether you achieved what you said you will achieve or not. So this is the personal plan care. I'm going to send it to you. So for this question, you will have just this one filled. You don't need to just contribute and agree to your own personal development plan. Demonstrate how to record progress in relation to personal development plan. So how you can record the progress. So this is 4.5. So let us go to 4.5. That's 4.4, 4.5 is here. Okay, so let us go back to the question again. It says, is that last one? This is the last one. So demonstrate how to record the progress in relation to personal development. So how can I demonstrate and record the progress in relation to personal development? So for you, can you tell me how you can monitor your progress? Like we just filled our personal development plan. How you can monitor your progress? Just say, after I fill my personal development plan, or as someone who works in care, I always, every year, I have an appraisal with my manager, and I have this personal development plan. We agree on where is it? So we agree on the goals which we need to achieve, training activities which we need to do in a certain times, and also we put timelines for them. And the way I monitor it is every year when we do the another appraisal, we check on the year before. Have we achieved all the learning activities? Have we achieved them on time? And this is how I monitor my development. Also, this is how I record the progress. So you record it when you do another appraisal. So just say in my nursing home, in my job at the moment where I work as a carer, I have appraisal every year with my manager. We agree on certain goals. We agree on certain planning and training activities to do, and we agree on the time scale to do them. So what it is, the year after, when we do the appraisals, we check on the progress. How did I have all the training done on time? What's my progress? And I can write down if I have achieved what I meant to achieve from the last appraisal. I write it down. And what did I not achieve? I still ask my manager to do it for me, like in terms of training, in terms of activities. I know it's not complicated. This unit is really easy if you concentrate, if you read the book, if you go to do some research on Google. We finished the unit 3, sorry. Which is personal development plan. I'm going to send you the link for the recording, and also I'm going to send you the paperwork, which was discussing just now. What you do, you read them, you understand them, you answer the question, looking at the recording again, stop it, go back to the question and answer them, and then go back, put the recording on, read the book. If you can't understand either of them, go to Google and do some search, but please don't copy and paste. You need always to understand and write it in your own way. Are we clear until here about Unit 3, the personal development plan, or do you want me to repeat any of these questions again?
No, thank you.
Oh, that's fine.
Okay, perfect. Thank you so much for attending. And if you, as I always tell you, if you have any, I'm just going to stop the recording now so I can send it to you.